Moving on. So belief 4, Claire. Death certificates are never wrong. We've partly covered that, but investigating deaths, not for resuscitation, things like that. What was going on that death certificates are never wrong? Are death certificates never wrong?
Well, no. We have covered that a little bit already, yeah. So I think the biggest problem in that regard was what happened in that first COVID winter. So we had a situation where there were 40,000 deaths from other causes, so deaths from cancers and from heart failures and from all the usual causes, which were not recorded in the data. 40,000 of them. And when this happened, what you'd see is that each week there'd be more COVID deaths and more missing deaths and more COVID deaths and more missing deaths until you got to peak COVID deaths. And that was the week of peak missing deaths. And then they both returned back to zero. So there was clearly something going on here where deaths from other causes were being called COVID deaths and treated as if it was all a catastrophe and disaster and we were doing so much worse than everywhere else. Whereas everywhere else was recording COVID deaths in a manner that equated pretty accurately with excess mortality. So every time there were extra deaths labelled as COVID, this was actually fitting quite neatly with excess mortality. And actually that's what's happened here subsequently. So we did a lot of shouting about this problem with diagnosis, and over time, the doctors seem to have taken something on board subliminally and got better at diagnosis. And then there was this match again between excess deaths and what they were calling COVID deaths. So yeah, I think there was huge overdiagnosis that first winter, and that meant huge inflation of the fear because the numbers were so much higher than they ought to have been. And some of the stories around that really are laughable. So one contact I know who is a consultant in an A&E department, he told me this story of going in to relieve the night staff the first thing in the morning. And one of them, he said he was just exhausted. He was just, really, really exhausted. And he said, look, you go off. He said, what happened? So he sort of heard the story of the night, and including, there's a tragic story of a person in their 50s who'd come in with a burst aneurysm on their brain. So they'd had a massive brain hemorrhage that was lethal. He hadn't come in dead. They'd tried their best, got him into a CT scanner alive, but it was too late and he died in their department. So we had to go and do the death certificate. So the consultant said, look, hand over me this other stuff. You go and do that death certificate, and then you get yourself off to bed. And he said, well, I can't do the death certificate. We haven't had the COVID test back yet. And that was the world we were living in.
Blown aneurysm on the CT scan, which is completely obvious. What CT scans are good at is showing blood in the brain. That's what they show. Just like a barn door, absolutely clear-cut cause of death. That was in no way related to a respiratory virus, and that's what he said. And you're like, well, this is just insanity. It's complete insanity where you can't diagnose a death at all without a COVID result. It really is hard to explain why so much distorted thinking affected so many highly intelligent, highly educated professionals. It really is a strange phenomena. In this chapter, Claire, death certificates are never wrong. You talk about extrapolate, excuse, exclude. What do we mean by extrapolate, excuse, and exclude?
So this was just me sort of looking at how the arguments would always go, and that we've sort of touched upon it a little bit when we were talking about how you have to keep looking at the evidence and seeing which are your assumptions. And people were extrapolating massively from a little bit of evidence to say something that was really, far too extreme, that was not really based on that evidence anymore, which I'd call extrapolating.
Yeah.
And then when there was evidence that contradicted people's position, they'd find an excuse for ignoring it or saying it was wrong or that it was biased or, whatever else. And, I'm guilty of doing that too. I think we all do that to form a case. But you need to be aware that you're doing that. I think that's what's really important. And then expunge is where people, are faced with something that they just want to ignore or exclude, I called it in the end, didn't I? Because it does contradict them. It's good sound evidence that contradicts them. And that kind of evidence is just getting censored. You just wouldn't hear it. That would not be heard because it would be contrary to the narrative.
Just didn't make the cut. Yeah.
Yeah.